Hello, my name is HSchreiner, and today I will be discussing type 1 diabetes. As of 2010, type 1 diabetes remains the seventh leading cause of death in the United States, according to the American Diabetes Association. There is currently no cure for this disease either, which is disheartening with such a high death rate. Most of these deaths are due to complications, due to a person not taking care of their diabetes and letting it affect their body systems in negative ways. Let's look at the etiology of type 1 diabetes. Diabetes is an autoimmune disease, and the pancreas is the main organ involved. Your pancreas is located behind your stomach. It contains beta cells with isolates, which make insulin to lower elevated blood sugar, and glucagon, which is made by alpha cells to raise your blood sugar. These hormones are then released into the body stream to control the body's blood sugar. Glucose is also another name for blood sugar. Glucose is vital to your health because it is an important source of energy for the cells that make up your muscles and tissues. It is also your brain's main source of fuel. Diabetes develops when the body doesn't make enough insulin or is not able to use insulin effectively, or both. A more in-depth explanation for this is when white blood cells, called T cells, attack and destroy the beta cells in the pancreas. This destruction may take place over several years, but the systems usually develop over a short period of time. Let's look at some symptoms of a person with type 1 diabetes. A person can have increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. Fatigue, irritability, blurred vision, slow healing sores, frequent infections such as gum or skin infections, and vaginal infections. Treatment and care of type 1 diabetes starts from the moment a person is diagnosed. Blood glucose is checked regularly, up to 12 times a day, and insulin injections are started. There are more than 20 types of insulin sold in the United States. These insulins differ in how much they are made, how they work in the body, and how much they cost. The doctor will find the right type of insulin for each person's health needs and lifestyle. This is all according to the American Diabetes Association. There is currently no cure for type 1 diabetes, but there have been many advances since the first diagnosis. The glucometers to test blood sugar are much more accurate and take less blood. Insulin shots have recently become easier with smaller needles. And the invention of insulin pumps and CGMs, which is continuous glucose monitors, is almost like having a pancreas on the outside of your body. Management of type 1 diabetes is dependent on the severity of their symptoms and their current blood sugar. They are either admitted to the hospital or sent home with a prescription for insulin, a glucometer, and test strips. They will be taught about diabetes management from a diabetic educator and a dietitian, and find an endocrinologist to follow their diabetes management. A person with diabetes will be on insulin therapy for the remainder of their life because the pancreas no longer makes the insulin they need to regulate the amount of glucose in the blood. They will need to test their blood sugar regularly to see if their body needs more insulin or glucose. Type 1 diabetes can affect major organs in your body, including heart, blood vessels, nerves, eyes, and kidneys. Keeping your blood sugar level close to normal most of the time can dramatically reduce the risk of many complications. Complications can be minor depending on how well a person takes care of their disease and how well controlled a person's blood sugar is. The higher the blood sugar, the more likely there will be complications. Some of these complications are neuropathy, kidney damage, eye damage, such as retinopathy and glaucoma, poor circulation, hearing impairment, skin and mouth conditions, coronary artery disease, heart attack, stroke, narrowing of the arteries, gastroparesis, foot damage, depression, and ketoacidosis. If a woman of childbearing age has type 1 diabetes before pregnancy, the pregnancy itself can be difficult and lead to complications for the mother as well as the child she is carrying. The mother is at risk for ketoacidosis, retinopathy, and preeclampsia. The baby is at risk for miscarriage, stillbirth, and birth defects. While this can be a very scary disease and can present challenges from the start, the resources available to diabetics in this day and age are overwhelming and should make a person's life relatively normal. One of the most important things a diabetic can have is a solid support system, be it friends, family, or the medical team caring for the patient.